everybody. I'm Kirill, by the way. Kim is my third cousin. Well, we've got an amazing panel over here, and we're going to try to make it a bit different. We've been talking and discussing around the same subject for the last 24 hours. And 2030 is close, and yet far. It's far if you're a patient, but it's very close in technology. Because what we've seen in the past few years, and especially accelerated by the pandemic, is the innovations that have come in healthcare. Why am I up here? Well, I'm a sports doctor, sports consultant, and in sports and in exercise, wearables, technology have become the norm. In healthcare, not so much yet. I also work in esports, but we've got a lovely panel over here, and I could ask you shortly, precise and straight to the point, a brief intro. Let's start with Giorgia being the one in red.
Hi everyone, I'm very happy to be here today and especially grateful to share the panel with such professionals. And I'm an engineer in the health and healthcare sector. I started my career in consulting, specifically in the healthcare public sector. And now I work for Doctolib as project manager, and simply we bring the solution inside hospitals and medical centers. Is a booking management systems, and the main challenge that we are facing now is the change management, because bring change inside hospitals and medical center is very difficult.
Thank you. Can we go around?
Hi everyone, I'm Mehra, a medical doctor by background and currently an associate partner and clinical safety lead at IBM in their healthcare technology division. Also the co-founder of Doctorpreneurs, which is a non-profit organization and community for medical innovators and entrepreneurs. So some of the work I'm involved in at the moment really focused on two different lenses. So firstly around how do we really improve the patient experience using digitally enabled technologies, really thinking about the front door, the digital front door, and how we engage patients and citizens better in their health and care, but also thinking about the clinician experience, which sometimes often gets forgotten about, and really thinking about the clinical workflow, how we can improve and enhance the experience for clinicians and other healthcare workers in hospitals and outside of the health and care system. So really looking forward to sharing some more thoughts and discussing the future of healthcare with you all.
Excellent.
Hi everyone, my name is Zhen. I'm the CEO and co-founder of Paperminds. My background is actually as a physiotherapist. I'm clinically trained as a physiotherapist. Right now at Paperminds, what we do is we're focused on helping the 200 million North Americans suffering from muscle and joint pain. And how we do this is with a twist. So we're building this empathetic conversational AI that for the first time can process people with pain at scale and help them find the right solution for their pain.
Hi everyone, nice to meet you all. I'm Arron. I'm a GP trainee or a family physician based in London, UK. I'm also a self-taught software developer, and I'm the co-founder of 𝐂𝐸-𝐷. And essentially what we do is quite simple. It's no secret that there are lots of problems in healthcare, and we believe that the people who understand those problems best are healthcare professionals themselves. And so that's why we teach healthcare professionals how to code, and we equip them and empower them with advanced digital skills so that they can build innovations themselves or even work with industry, hospital management, software developers to build innovations.
Hello, everyone. So I'm Lambert Montevecchi. I run a change management consultancy firm focused on hospitals called Boost Consulting. I don't know how legitimate I am to play with a crystal ball and predict the future, but I'm really happy to be on this panel and express my opinions and my thoughts.
Thank you. Question to all the panel, but we'll go through it. The buzzwords: patient-centric, patient-first, patient empathy, patient involved in everything. Where do you view that in 2030? Now we talk about it. As healthcare professionals, most of us are healthcare professionals, we're brought up in the mentality that the patient should always come first. The reality is you have a handful of minutes to deal with the patient, and the patient sometimes does not come first. In these 8 years, can technology make us a more patient-centric provider?
So before I was coming up here, I was reflecting firstly on the patient experience today. Me as a patient, what was my last experience as a patient? And it takes me back a few months ago when I was needing to be investigated for an ENT issue, ear, nose, and throat issue. So I went to my GP, was seen pretty promptly, and then referred on to specialist care. And if I then think about what happened next in the journey, the referral letter that was meant to be sent to me never arrived. It was actually sent to a different address. And by the time it eventually landed at me, it was for an appointment a year later. Now, I'm a medical professional by background as well, and even I was quite shocked at that. And then I thought to myself, wait a minute, why is this the case? And there are so many issues today, if we look at the patient experience. We're all patients at one point in our lives, that are fundamentally broken. And a lot of basic things that are fundamentally broken today. And I'm talking, maybe with experience in the NHS and what's happening in a system that was designed at one point in time with a phenomenal, ambition, but currently isn't serving the needs of citizens. And so reflecting on that really made me think, yes, absolutely technology can help. And we've heard today, we've heard yesterday about all the phenomenal potential that AI and blockchain and virtual reality and the metaverse can potentially bring. But fundamentally, we talked about patient empathy, patient centricity, and really understanding what you go through as a patient on your journey when something happens. And I think we need to better understand that as technologists, as founders, as clinicians, as professionals within the industry before we can really get to sort of aspirational ideas of what healthcare in 2030 is going to look like. And so for me, I'm always grounded by, again, trying to really understand the experience that exists today, the challenges that exist, those basic things that need to be solved. And then, yes, leverage technology where we can. I'm a technologist at heart, for sure, but I understand its limitations too. And so that's just a bit of, from my side, to start off.
Giorgia, Doctolib, leaders, billion-euro company. Where do you fit into the patient experience? Where does your company want to go in the patient experience?
The experience that we cover is the beginning, the booking funnel, so the starting point. But in my opinion, the experience should cover all the three channels, not focus only on the digital one and the technology. So it should cover the digital one, the physical one, and the hybrid. We are going also in the direction of the devices that are able to interact in smart environments. So we'll have humanoid assistants in our homes, but also medical devices are able to interact with the environment. And I think that we need to think to start as a patient, as a person first, and as the framework, not patient-centric, but human-centric. And based on this, provide a kind of comprehensive platform that integrates all the service offered, spanning from the digital ones, so the apps that we have and you use every day, but also including this hybrid device, but also the physical one. I imagine to streamline the processes, also having, for example, the smart fast checkup around the city, so a kind of hub, so physical, because we need also the physical experience to the patient. We have to avoid to think that everything will be only digital, because I think that this is not the right way.
Well, hybrid would be ideal, eh? Like, it would be great if all our cars were hybrid as well, but sometimes it's not what we would like only, it's how we're going to get there. Paperminds, we spoke before, and you brought up the empathy aspect of the clinical experience.
Yes, definitely, and it's such an interesting question. I had this lovely conversation yesterday with other doctors and clinicians at the dinner, and we're speaking about the key to success, about what is patient-centered, really, because that's a buzzword. But at the core, it's really providing this empathy to make the patient feel seen and heard. Because that's the key to success. Because you could come up with the right treatment, with the right diagnostics, but if the patient doesn't follow you, then what's the result? So I think with the power of technology, for the first time, and we're really excited about that at Paperminds, for the first time, we're able to create some kind of empathy to really get the necessary information to personalize the solution for the patient. And that's what I'm really excited about.
Okay. Arron, you're the app guru over here. How can we empathize through an app for the patient? Do it medically oriented, do it patient oriented? Can you find a way to combine both?
So that's a very difficult question to answer.
Thank you.
Yeah, it's a good question. Because I think we're kind of getting to the stage where we're able to create apps that address specific clinical issues, but obviously there's more to a patient than a clinical issue. It's a very broad, holistic approach. So when you see your GP, it's not just about the specific medical problems, and actually there are a lot of medical problems that have underlying factors, particularly with mental health issues, that have underlying psychosocial, other elements that need to be addressed as well. And I think over the next decade or so, I think we're kind of nailing the clinical side of things, but we really need to start focusing on the more holistic approach to the patient, addressing, for example, empathy, but also other elements as well, and start combining that. And I think that's somewhere where the NHS app could really do quite well.
We use those type of apps in sports, where the first thing we ask is, how are you feeling? Literally, the athlete has to fill in that questionnaire on a daily basis, if they're injured or if they're not injured. So this technology, it's just finding the right patient base. Lambert, how are we going to change the mentality that we're brought up in medical school and in the medical world to become more technology-philic rather than phobic?
Another difficult question. That wasn't what you were supposed to ask me. No, I'm just kidding. Well, I think our biggest enemy is ourselves. I mean, the resistance to change. It's an obvious thing for me to say because our modest contribution to healthcare is try to accelerate, implement change. So we heard, as some of my fellow panel speakers have said, we've heard that the system is on fire. So we're trying to introduce innovation, new technologies on a system that's on fire. No need to talk about COVID, but we saw how fragile the system is, how unpredictable it is. So we're adding complexity on a system which is already very complex. So you didn't ask me that question, sorry, but 2030, I would be happy to see minor improvements. Let's be realistic. More involvement of patients. That was the preceding panel, but that's definitely a way forward. And well thought out, well designed, new technology that has involved patients, that really solves a problem. That's been said on 200 panels. And you touched upon maybe education from the very beginning. We're just beginning to change the way doctors are educated about all the soft skills that they need to do their job. I have the privilege of spending days, months, weeks in hospitals. And I come to these conferences and see all the amazing stuff that's there, but I cannot help but measure the difficulties of actually deploying it on the ground.
You hit the topic right on the nail on the head over there. Training. I can say personally, medical school and most of my medical career, technology training does not exist. It's not there. So how do you expect the people who are the end users who want to better the experience for their patients, for their clients, how can we expect them to take on technology they're not trained on? Or not even open-minded enough to deal with it? Now I've got 8 years. I'm speaking through personal experience through sports and exercise medicine, where having the idea of exercise prescription and the importance of sports implemented in the curricula of trainees, both medical and paramedical, was a constant battle throughout, and it's all over the world. I believe we're going to face the same battle when it comes to technology. We've got a curricula that are packed more than a boiled egg, and yet we are expecting that in the next few years, technology is going to overtake a lot of the job we're already doing. So how we're going to find a hybrid solution if we don't educate the people who are going to be the end users? Now, you guys know about this stuff, but for an idiot like me, and I can say that because I know I am, okay, who is not the most technology savvy guy around, how am I going to be able, in my practice, for the next 10, 15 years until I retire, use this technology if I don't know about it?
Yeah, it's a really important question and point, and an area I'm personally very passionate about. And actually, through Doctorpreneurs, we do a lot of work in the space around educating medical students and clinicians around digital transformation, healthcare, and the new technologies that are coming. But it shouldn't be up to organizations like Doctorpreneurs to do that. It should be part of the medical school curriculum for the future clinicians and other nursing professions, dental school professionals. Absolutely, and we're not seeing enough examples where it is fully integrated within the curriculum. You see sort of pockets of excellence where there's a one-off course or a one-off module that a select number of students may get access to, but fundamentally, across the health and care workforce, we need it part of the curriculum and then part of training as well, in terms of if you are a GP trainee or a surgical trainee, you should be able to explore and not have to be proactive about going and searching opportunities. You should be able to be educated and explore opportunities alongside your practice that will educate you in these new areas. And it's not just also about the clinicians and healthcare workforce, but then how do we take that to the citizens and general public? And we heard a lot about health literacy earlier. And how do we really break it down and really make the content digestible, easy to understand? So when a patient is engaging with a health application that potentially uses AI-based algorithms, that they understand to a level that's deep enough to earn trust and understand what they're going through from an experience, but also not overcomplicate things to unnecessarily create fear. And getting that balance right through the right delivery of education and content is really hard. And I don't know many countries who've cracked it yet, and I think it's a huge area.
So I just want to jump in here, because I think you've raised some really, really good points, and we're actually kind of going into a territory that's really quite a passion of mine. So one of the apps I've developed is called 𝐂𝐸-EPR, which is essentially a customizable educational electronic patient record system for simulation training for doctors, medical students, nurses, and so on. And the rationale for building it actually was, as doctors and medical students, and nurses, we do our simulation training with the mannequin, paper notes. You treat the patient as they were a real patient in like some sort of emergency situation. But then when you actually go on to work in a real clinical environment, you're using electronic systems. You're not using paper notes, you're not using drug charts and so on anymore. So essentially that was a rationale for building this simulated EPR system. And I'm really pleased to say it's now being rolled out across the Southeast England region as part of a kind of pilot/research trial in collaboration with Health Education England. So I think we've kind of realized actually where we've been very patient-centric focused, but I think we're realizing that kind of the way we train our workforce has kind of been left behind a little bit. And now we're kind of playing a catch-up game to kind of balance the books in some ways, like make clinical training actually like the way clinical practice really is.
Avi and Arron brought such wonderful points. To me, it's a two-step process on how the doctors and other clinicians will be able to adopt this kind of technology. So the first step is co-build with actually doctors to implement the proper processes. That's number one, because a lot of apps are built without thinking about the doctors. And then what happens is, well, doctors don't have the time, or they don't find it reliable, consistent, and they're like, well, I don't find it's going to be good for my patient. The second phase, which I think is very interesting because you see it with Arron here, he's medically trained as a doctor, but he's also in software engineering. So I think that's the next step of the generation where we'll see, and I'm sure there are other people in this room who are trained clinically, but also have some background in tech. So they're going to be the bridge, just like MD, PhD, the bridge between tech and med.
And a company like yours?
I completely agree about what you just said, because I think that there are two sides to consider. So first of all, to think about technology as a support or not instead of, because most of the time it's the way we communicate technology that I think is not correct and appropriate, because the doctors are afraid that the technology will be their substitute. And it's not should be seen like this, but the technology is the enabler to facilitate the processes and improve all the activity that they have to manage every day. And from the other side, I think that a good point is to create a technology that are able to adapt themselves based on the level of digitalization of users, and then brings modular functionalities that are able to be unlocked based on the users that we have in front. Because, you know, from the youngest to the oldest one, we have different level of digitalization. And I think that even if the education is this focal point, at the other side, the level of different users should be taken into consideration, because we are not the same level. But the technology should be inclusive. Nobody should be left behind.
Okay, that's easy to say, but you know as well as I do, to make it implemented is different. Even nowadays, for patient appointments, they got the wrong address for you. Should I send you a text? But then becomes data protection. Maybe you change your mobile as well. So it's not that easy.
I know.
Maybe by 2030 we would have solved it.
But, you know, I'm dreaming, no? There are 8 years from now.
If you don't dream, you won't dream.
There are some good practical examples. Just to give you one, just on that point, some work colleagues in IBM have been doing in Germany around the development and implementation of a end-to-end encrypted personal electronic health record platform for citizens of Germany that's been now something that's legislated, and all health insurers, private or public, have to provide. And so you can see examples where, and highly secure, incredible encryption, incredible security and safety focus, where though it's really impacting the citizen experience in health and care, where you can very easily and securely book your appointment, track your appointment, access your personal health record, access your appointment letters, and do it in a very seamless way with the trust that your data is secure and you have control over it. So there are pockets.
Malta has the technology and we use it. It's just the end user, the patients, don't tend to use it because they're not as IT savvy as they could be. Yep. But the technology is there, and it, being a small country, we can implement it. And that is the trend. Last question for Mr. Lambert. You're the change maker. You introduce yourself as that. How are we going to change the mentality of geriatric doctors like myself to use more technology?
The silver bullet. I think, to be positive, things have improved quite a lot. I mean, these types of conferences 5 years ago, people were saying, our AI solution is smarter than humans. That's not what you want to be saying to the users. And now we're saying, you know, we are going to produce technology that enables, that facilitates, that supports decision-making. I think we've learned from these lessons. I say we, although I don't sell technology. There's more humility, and there's definitely, and that's the good news, a much more profound understanding of the complexity of healthcare. So those are, I think, ingredients that were needed, that we've acquired over time. The challenge is still, in my opinion, just as great, because the system is under pressure, it's complex. A lot of the solutions don't necessarily fix the problems, either for the patients or for the doctors, but that's the industry's challenge to fix. But if we're projecting ourselves 8 years, I'm hopeful that some of this technology will actually deliver, that the users will see the benefit, and that we'll see some improvements.
Thank you. Thank you all. So if I had to summarize, I could say patient first, hybrid solutions, and hopefully by 2030 we'll get there if we find a strong education background for all users and all stakeholders, because I think that's going to be fundamental. Because if you don't know about something, you're never going to promote something, and if you cannot use it, then the patient's going to suffer at the end. Thank you all very much.